Hello and good evening. I'm Melissa Idris.
I'm Sharad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Prime Minister Muhyiddin Yassin has responded to that open letter that was penned by 46 health experts that called for 10 crucial actions to manage the COVID-19 pandemic in Malaysia. So over the next half an hour on the show, we will be speaking to 3 of the 46 signatories of that open letter to ask them if their concerns were addressed today. Now, joining us first, we have Datuk Dr. Zainal Arifin Omar. He's the president of the Malaysian Public Health Physicians Association. Dr. Zainal, welcome to the show. Thank you so much for joining us tonight. Now, do you feel that the concerns that were raised in the open letter have been addressed by Prime Minister's response today?
Okay. Before that, few of us, I think group of us, have been talking about this suggestion and talking to the government, at the early part of this pandemic, last year, even in March and April. So it's good that PM has responded to our letter, and but I still can, at least what we can call it, PM or government is now a listening government. So at least they listen to us. But the problem is we don't have a clear-cut strategy of government or Ministry of Health. What we see now is some sort of a reactive, keep on changing according to the current situation. Because all this problem, all the situation was anticipated long before it happened. I think after June or July, so most of the experts in the country have this concern and voice up about the issues and what is the proposed strategy. But until recently, when that letter was put up, so PM responded. I think it's a good move, but still a bit late. But it's okay. Yes.
Yeah, Dr. Zainal, precisely the question of, it coming so late in the day, as you noted, experts had already been, signaling where the problem areas might be. But can we look at the specifics of the Prime Minister's letter itself? And is there anything in the letter from the Prime Minister's office that suggests that they have a change of heart, that they are willing to recalibrate, go back to basics in terms of public health management, which, was something that was raised in your letter to him?
To be honest, I read the letter through and through. The first paragraph said whatever he told them, we already did it. Already planned, or they're going to do something in future. So in that case, I think government sees that they know what to do, and this our concern is an extra voice for them. So in fact, until now, we don't really see what is the actual. That 10-point concerns. What is the actual government going to have? What to do with the plan? Yes.
Dr. Zainal?
Yes.
So in the 11 days that it took for the government to respond to the open letter, the Ministry of Health has made some changes, right, to testing. That means just testing those with symptoms or about 10% of cohorts within a certain cluster. I'm wondering, are those changes, that kind of recalibration done by MOH, is that in line with what was proposed in the open letter?
Yes, we proposed these strategies long before. For example, when we saw an increasing in trend of cases, and then we've seen that signs of impending overburden of the health system. So some of us already suggest or propose this kind of strategy. But until recently, government has changed the strategy just because of this overburden, But it's good that it's parallel with our concern. But as we see it, it's a bit late because it's already happened. Should we plan before it happened? Yes.
Dr. Zainal, there's, one of the points that were made in the open letter to the Prime Minister was what you call silent epicenters, and prisons, detention centers, communities like migrant communities, refugees in particular were mentioned in the open letter to the Prime Minister. Do you sense that the government or people within government understand why it is important to deal with this? Because there seem to be mixed messages. Khairy Jamaluddin talking about working in a cooperative fashion with undocumented workers, and then other ministers talking about getting the army to arrest undocumented workers and put them into detention. Do you think that they truly understand what a public health perspective is in managing this pandemic?
No, I think the government or the agency should sit down and properly discuss and analyze this problem. Because right from the start, we say that the confinement, the penjara, the party, the foreigners, all this is some sort of, they are the ones who create a clusters in the community and later on giving to these community infections. And they are the confined, they are marginalized. So a few department or agencies should look specifically on this confinement. For example, the penjara, the detention center, and take care of them because they are already confined. And for the other group, for example, the foreigners, the party, so everybody has to go into the settlement and talk to them and see how their living condition and how we can tackle them. Because very easy because they are still in a settlement. So if you mix them with the normal community, so it's very difficult because it's some sort of threat to this community, and they try to run away from authority. Yes, it's very difficult to control the infection if we don't some sort of soft approach toward this community. Yes.
Right. Okay, Dr. Zainal, the Prime Minister has agreed to set up an advisory group to kind of guide the government in its public health response, this perhaps coming from the 46 signatories. I'm wondering just how much say do you think this group might have in terms of the government listening to its advice? What kind of inclusion do you expect and do you want to see from this advisory group into the public health response from this pandemic?
This is kind of something new for our government because the concept of government know everything and the authority will do something, and sometimes they consider the outside voice as a noises, disturbances to their plan. So we hope that this advisory committee, everybody should have an open mind, what we call intellectual discussion or discourse, and we come up with better strategy for government or for the people. Because everybody have a blind spot. If we have many people, so we can closing the gap of these blind spots, and we can come up with a better strategy for our population. So that's our hope, because this is something new and something to look upon. Yes.
Okay, thank you, Dr. Zainal, for your time joining us on the show tonight. We will be taking a quick break here on Consider This, but we'll be back with more, so stay tuned.
Is still on. It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of a new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
COVID-19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid closed conversations, avoid crowded spaces, and avoid confined spaces. We can beat this together.
The war on COVID-19 is not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus, be it social distancing, hand hygiene, and wearing of the face mask. It's a new norm. Let's not slack. We can do this.
We've done great so far, but the fight is far from over. We need to be vigilant to keep ourselves and others safe. Wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't be lax.
We all know the war against COVID-19 is still on. It is our responsibility to adhere to all the
Welcome back to Consider This. I'm Melissa Idris. With me is Sharad Kuttan. Let's continue our conversation with health experts who were signatories to that open letter to the Prime Minister regarding the management of the pandemic. Joining us on the line now, we have Dr. Jahiza Hassan. She's the president of the College of Anesthesiologists with the Academy of Medicine of Malaysia. Dr. Jahiza, welcome to the show. Now, were the concerns that were raised in the January 7th open letter, were they addressed in the Prime Minister's response today?
Thank you for having me tonight, Melissa and Sharad. Very good evening. Assalamualaikum warahmatullahi wabarakatuh. I think from my perspective as a clinician, I think it was a very welcoming to see that our Honourable Prime Minister reached out to the panel of experts who wrote in that letter. I think that is a very positive outcome, I would say, from the letter for us to collectively contribute to reduce these infections and hopefully subsequently reduce the impact on the lives of the rakyat as a whole, and hopefully will be in a better position as a country, really. And I think for the Honourable Prime Minister has agreed to form a health and scientific COVID-19 advisory group. We will advise the government on matters related to COVID-19. To me, it's a very welcoming move. Even though we will not be too sure what the outcome will be, but looking on the positive side, I think it's a very welcoming, honestly speaking, and we hope to address, as being mentioned in the letter, to nominate suitable candidates, to be members of that advisory group of health, and to the government. And I think that's a very positive way forward.
Right, Dr. Jahiza, there's one problem though. One of the issues that have been raised by many people, including the Selangor government, is the inability or the unwillingness of the federal government to share information, and the lack of understanding as to if data is driving the policy decisions that are being made. The fact that 5 of the 46 signatories to that open letter are going to be included in an advisory panel does not necessarily address the lack of transparency that exists at the moment. I mean, how much more transparent will the management of the pandemic be with 5 extra members to advise, or experts rather, to advise the government of the day?
That's a very tough question. I'm no public health expert, but as an ordinary clinician who practice day to day in the government public hospital as a cardiac anesthesiologist, I think probably there are certain things that we are not familiar with. I think we are in an unprecedented situation. There are certain issues that was never being raised or worked collectively as we are doing now. So there are certain rules and regulations that has been put forward already, and it's not easy to just shake it away, because there are certain ways that we do things in the Ministry of Health, in the government, even within the Ministry of Health. We have so many designated divisions. For example, our Director General of Health, who's doing a remarkable job, he can only take care of the medical section of it, the perubatan side of it. The administrative side of it will be handled by the KSU and the PKSU, Keuangan and Pengurusan. So there's so many interrelated divisions that at the moment, I think we are still working in silo. Maybe not because we do not want to, as an entity, is the way forward. I think we are not familiar with it. There are certain areas that we just do not want to overstep our colleagues even in the Ministry of Health. And I think this is a very precedented move and a welcome move by the Honourable Prime Minister. And there are many panel experts who has been in ministry, like for example Tan Sri Bakar, who was the Director General of Health before. So maybe he will be be able to lead together with the President Director General of Health to get all these divisions within even the Ministry of Health together with the JPA and the SPA, and as a group, maybe we can move forward. I think we just have to work together. We don't have a choice about it.
I understood. So you're pointing out that even within the Ministry of Health, there are divisions, there are silos. What then, if we bring in the private sector to work with the public sector? Now, let's talk about, the management of critically ill COVID-19 patients, or private hospitals taking on that role. How do you see that working if within the public health sector there's already silos? Do you see data being shared? How do you see that cooperation working out?
Again, like I said, because we are in this pandemic together, we are actually in a war with an unknown, unseen enemy. I mean, just think about it. If we are in a real physical war, will we be talking about the way we are talking now? We will not. But because our enemy is somebody or something or an organism that is so invisible, we are still having this kind of conversation. But I think most of us, I would say nearly 95% of us clinicians and administrators are thinking along the same line. It's just a matter of getting it done. And that's why sometimes you need someone outside the domain of the present system to get it going. And I honestly speaking, I believe it can be done. Because most of us...
Dr. Janasia, can I, sorry to interrupt you. You also signatory to another open letter this time by the Malaysian Society for Intensive Care. Could you very quickly tell us what were your concerns in that letter? Because you did mention critically ill non-COVID-19 cases. You talked about, private hospitals being allowed to make their own policies. What are the main points that you wanted to raise in that letter?
Actually, I think as a fraternity, all of us, anesthesiologists, intensivists and critical physicians in the public hospital and private hospital, I mean, we are a very cohesive group of doctors actually. We discuss about it openly, and it's really trying times, honestly speaking, because, for example, the public hospitals, we have to cut down on our semi-emergencies, a lot of cancer cases, a lot of chronic ailment that need to requiring more critically intensive care beds are being denied because we have to make room for patients that is coming in for COVID. I mean, it's something that we just have to do it. So because of that, we sacrifice our wards, for example, to fill in with those category 2 and 3 at the moment. The minute they go to 3, 4 and 5, they get to go to ICU or HDU. So because of that, all the beds are being, not to say all, majority of the beds are being vacated. And there are mixing of discipline within the wards. For example, oncology with respiratory, medical with other ailments. So it's not conducive either. I mean, just put ourselves, if we have a family members who need to be admitted, to be sharing wards, waiting for beds to be emptied before they can be even moved from emergency department to get into the general ward. So I would think the easiest way to move forward really to get all these non-COVID cases, the semi-emergencies and the at least the semi-medical patients that require care should be moved to non-COVID hospital. Having said that, the private hospital must also be cognizant of the fact that it's already in the community. I mean, and patients tend to go to their own respective physicians, and because of that, they might be the one who are carrying the COVID virus with them. And if they were having, for example, category 2 to 3, and they might get admitted and having later discovered they are COVID positive. So it's just a matter of preparation and getting ready.
Well, thank you for bringing that up, and thank you for joining us on the show. We're going to take a quick break, but after this, we'll come back and speak to the president of the Association of Private Hospitals Malaysia to get his take. Stay with us. We'll be right back.
COVID-19 is still on. It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of a new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
COVID-19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid closed conversations, avoid crowded spaces, and avoid confined spaces. We can beat this together.
The war on COVID-19 is not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus, be it social distancing, hand hygiene, and wearing of the face mask. It's a new norm. Let's not slack. We can do this.
Thanks so much for staying with Shiraj and I on Consider This. Joining us now, we have Datuk Dr. Kuljit Singh. He's the president of the Association of Private Hospitals Malaysia. Good evening, Dr. Kuljit. We understand there was a meeting that was held between your association and the Ministry of Health, this regarding the cooperation between the public and public health and private hospitals. Now, could you help us understand the issue of how to match the needs of the public sector with the capacities in the private sector?
Okay, thank you very much. Private sector hospitals are actually pretty much different than what you will see in a public sector hospital. Public hospitals are probably designed in a different manner, and the private hospitals come in different types. We have got smaller hospitals with 2 or 3 ICU beds, and we also have private hospitals with about 10 beds ICU. And the structure in terms of manpower in a private sector is totally different when you compare to a public sector again. You have house officers, medical officers, a lot of specialists in in the public sector. So when you look into a private hospital, the dynamics of the human resource is totally different. So when we discussed with the Ministry of Health, we have mentioned to them that we are ready to accept COVID patients, but there are some limitations that we need to consider before we can tell them the number of patients that we can take at any given time. So that's a discussion that we had, and today the Prime Minister has announced in terms of financial aid, they're willing to help us. And we are also looking at the insurances that they can pay for their clients when they come to our private hospitals.
Dr. Kuljit, what then are what would be the command structure, as it were? I mean, do you want private hospitals to be able to have a fair amount of autonomy and say push back on requests coming from the public sector, or does the government actually think that there needs to be a command structure centered in the Ministry of Health that can in fact insist that private hospitals take on whatever it is that they feel needs to be done?
Okay, at this point of time, as we speak, there are already patients that visit private hospitals and they're detected to have COVID. And it's not much of command that comes from the Ministry of Health at this point of time. We have our own patients who have come to us. They have got COVID. We are managing them. And as we speak, we are still trying to get them to see and follow up their treatment or continue the treatment in public sector. So we don't have this autonomy as such, because in 2020, COVID was exclusively treated by a government facility because there were acts that they had followed, and that was how it was done in 2020. Now with the emergency ordinance, there has been some changes. And with that, we are now allowed to treat COVID to an extent based on our capacity and capability. But more importantly, we have told the government, we are happy to take over their non-COVID patients in order to decant their space in the public so that they can concentrate more on COVID patients in that sense. And to treat non-COVID patients in private setting, we are pretty ready. We can do that without much of difficulty. With today's announcement, it gives us a little bit of a startup that the government is willing to pay for COVID and non-COVID in that matter.
Do you expect that to be enough? I mean, I know the compensation is still under discussion, but are private hospitals expecting to absorb some financial losses through this?
I think starting with 100 million is a good startup, and definitely it will not be enough, because we are not sure what are the kind of numbers that we are going to get from the public sector, how many patients are going to be referred to us. The details of the entire process are not clear yet. It's just an announcement. We're going to sit and discuss with the government to find out what is going to be the referring mechanism, what kind of patients that we are going to see. And all those details need to be detailed out before we can start getting this process done.
Dr. Kojit, could you help us understand where private clinics and GPs fit into this overall picture of public-private participation in the pandemic's management?
Well, I don't really represent the general practitioners in the private clinics, though I used to be the Malaysian Medical Association secretary many years ago. I think in many countries, the primary care physician has played a very important role in COVID. And unfortunately, in Malaysia, the private practitioners did not really take that role. And they were actually willing to take up the role, especially in terms of screening patients. And we also hope when the vaccination starts, the private practitioner or general practitioner should be able to do at least vaccination, testing. These are the kind of things that many countries in the world had used general practitioners in this area. And they will also be feeders to hospitals, and they detect a patient who's about to get into category 3. They would be able to diagnose and make arrangements to get these patients sorted out to be sent to the right hospital.
Well, Dr. Kojit, since you brought up vaccinations, I'm wondering, with the national vaccination rollout happening soon, do you see a role for private hospitals, private healthcare, in making sure that the execution of this plan is effective?
I must comment. It's very commendable effort that the Ministry of Health has made from the onset. When we started discussing about vaccination is from as early as November last year, they made it very clear that the private sector will be helping the public sector together when vaccination gets into its place. They have not got the detailed mechanisms as such, but at least they have made this commitment that the private healthcare workers, doctors, nurses in the private healthcare will be inoculated together with the private healthcare workers to start with. And they also mentioned there will be mechanisms on how public and private will work together to get the inoculation going. So I think I must say Ministry of Health has been very upfront when vaccination is concerned.
All right, Dr. Coulter, very quick question for you. The Prime Minister announced that it will be a one-year rollout for the vaccination. This was much faster than what was announced by Khairy Jamaluddin. He said 18 months. Is this realistic? 1 year? You're a doctor. Do you think it can be done?
I think nothing is impossible. If you have good mechanisms, good arrangements and organization, you see many parts of the world. You look at Singapore, for example, It's a small country, but at the rate they have gone into their vaccination, very methodical, and we find that even foreigners, including visitors who are living in Singapore, have been inoculated. Expatriates, ambassadors, they have a good framework. And I'm sure with a good framework, it is not impossible, because in Malaysia, we've got wide range of healthcare facilities, almost in every part of the country, districts, and even in the kampong, you have got healthcare clinics. I don't think so it is impossible. Once we get the vaccine in, I think everybody is going to work towards it, because I think that will be the main way that we can actually bring the pandemic down.
Thank you so much for your time joining us on the show tonight, Dr. Koljit. We appreciate your insights. That's all we have for you on this episode of Consider This. I'm Melissa Idris.
And I'm Sharad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.